For more anatomy-related videos, please subscribe to my channel, Learn with Dr. Tanya Hashik.
In this video, we will discuss about the coronary circulation. That is, the blood supply to the heart. That is, heart is an organ which pumps blood to the whole body. So, how the heart gets the blood? It is through the coronary circulation. So, there are specialized blood vessels which supplies the heart. So, they are the coronary arteries. They are of two types, that is the right coronary artery and also the left coronary artery. Right coronary artery, it supplies mostly the right part of the heart, and the left coronary artery supplies mostly the left part of the heart. So first we will discuss about the right coronary artery. So the right coronary artery, it arises from the anterior aortic sinus. So what is the anterior aortic sinus? That is, in the aorta just above the semilunar valves, you can see three dilations. That is the anterior aortic sinus, left posterior aortic sinus and also left anterior aortic sinus. So from the anterior aortic sinus arises the right coronary artery, and the left posterior aortic sinus arises the left coronary artery. First we will discuss the course of the right coronary artery. First it passes forward and to the right to emerge on the surface of the heart in between the root of the pulmonary trunk and also the right auricle. In this figure you can see that the emergence of the coronary artery in between the root of the pulmonary trunk and also the right auricle. After that it moves downwards to the right coronary sulcus to the junction of the right and inferior border of the heart. So after it reaches the junction of the right and the inferior border, it winds down the inferior border to reach the diaphragmatic surface of the heart. Here it moves backwards and to the left. So here it moves backwards and to the left in the posterior coronary sulcus to reach the posterior interventricular sulcus. So in this figure, I have drawn the posterior view of the heart. Here you can see that the right coronary artery, it winds through the inferior border and it reaches the diaphragmatic surface of the heart, and here it runs backwards and to the left to reach the posterior coronary sulcus and to the posterior interventricular sulcus, and it terminates by anastomosing with the circumflex branch of the left coronary artery. So the right coronary artery, it anastomoses with the circumflex branch of the left coronary artery at the crest of the heart. So in this figure you can see that the right coronary artery anastomosing with the circumflex branch of the left coronary artery. This is the crest of the heart. Now we will discuss about the branches of the right coronary artery. So it gives mainly two types of branches, that is the large branches and also small branches. So the large branches are the marginal artery and also posterior interventricular artery, and the small branches, they are nodal artery which supplies a same node, right atrial artery supplying the atria, infundibular artery, terminal artery, right ventricular artery, coronary artery, etc. So these are the branches of the right coronary artery. Now we will discuss the area of distribution of the right coronary artery. So it is distributed in the right atrium, right ventricle. Most of the part of the right ventricle is supplied by the right coronary artery except at the anterior interventricular groove. That is, here it is supplied by the left coronary artery. A small part of the left ventricle near the posterior interventricular groove is supplied by the right coronary artery. That is, small part of the left ventricle is also supplied by the right coronary artery at the posterior interventricular groove. And whole of the conducting system in the previous class we have already discussed the parts of the conductive system and whole of the conducting system except at the AV bundle. Near that is AV bundle, it branches to left and right branches. So the left branch, it is supplied by the left coronary artery. So now we will discuss the course of the left coronary artery. It is larger compared to the right coronary artery and it emerged from the left posterior aortic sinus and it moves forwards and to the left to emerge between the pulmonary trunk and also the left auricle. And here it moves downwards to the interventricular groove and here it gives the anterior interventricular branch of the left coronary artery. So this is the anterior interventricular branch of the left coronary artery. And from there on, it moves as the circumflex branch of the left coronary artery. So, in between the left auricle and also the left ventricle, you can see the circumflex branch of the left coronary artery in the left atrioventricular groove. After winding the left posterior border, it continues in the left posterior coronary sulcus and near the interventricular groove, it terminates by anastomosing with the right coronary artery at the crest of the heart. So, the circumflex artery, it continues in the left posterior coronary sulcus and it terminates by anastomosing with the right coronary artery. So, this is the course of the left coronary artery. Now, we will discuss the branches of the left coronary artery. So, first one is the large branch, that is the anterior interventricular branch and also marginal artery. So, these are the large branches and small branches are left atrial branch, pulmonary and also terminal branches. In this figure, I have not given those branches. Now we will discuss the area of distribution of left coronary artery, left atrium. Most of the left ventricle is supplied by the left coronary artery except at the posterior interventricular groove which is supplied by the right coronary artery. And some part of the right ventricle is also, that is some part of the right ventricle is also supplied by the left coronary artery, that is at the anterior interventricular groove. So now we will discuss what is cardiac dominance. So you have heard the term the left dominance, right dominance, etc. Right dominance, it is more common. That is mostly the posterior interventricular groove, it is supplied by the right coronary artery. But in some cases, if the right coronary artery is small, the circumflex artery, that is the circumflex branch of the left coronary artery, it supplies the posterior interventricular groove. And in such cases, it is called as the left dominance. But in all other cases where the right coronary artery itself supplies the posterior interventricular groove, that is called as the right dominance. So, in the upcoming sessions, we will be discussing about the coronary veins. So, this is the end of today's video.
This is the end of today's video. For more videos, please subscribe to my channel and press the bell icon.